예, 안녕하세요. 아이진의 조양재입니다.
Hello, my name is Yangjie Cho. It is my great honor to be here to have an opportunity to introduce my company to the audience. Today, I'm going to talk about the mRNA platform. Our company was established in 2000. When public in 2015, we have been growing steadily. Myself and co-founder Won-il Yu used to work together at Chil Jedang's R&D center, and I joined the vaccine team since 1992 and have been working since then for the vaccine development. As you can see, for the last 20 years, there were many clinical trials that were conducted by ourselves. There were licensing out strategies and programs. We focus on research and development rather than processing itself. So what we are doing at the moment in our R&D portfolio is, I would say, largely two different things. One is on COVID vaccination. We're carrying out clinical trials in Korea and Southeast Asia. South Africa, we're trying to launch the clinical trial, but not yet. And in Australia, we're testing boosting, and in South Africa, we're preparing an Omicron vaccination research project. And also for ophthalmologic treatments and medicine, we're working very hard. And in Australia, we have now completed from the first stage of clinical trial for human papillomavirus, and I think we're waiting for a great result. And now I would like to move on to mRNA platform. Many of people are talking about the development or prospect of mRNA, and I would say mRNA vaccine type 1 in the battle for the COVID-19 pandemic, but there are many different advantages of mRNA vaccine. It has excellent safety, and it's a system where we can develop and make vaccine in such a short span of time. And also, this is a facility of Moderna that I put over here on the slide. I would say the biggest strength it has is that even like 2 years ago, there was no commercialization facilities for mRNA vaccination. Think about it. So there was no such a thing in the world, but all of a sudden, we are now trying to build mRNA vaccination. What do you think it would take usually for conventional vaccines? But for mRNA, all you need is three different facilities, and for one batch, you all only need 5 days. The facility you need is just the cell culture and membrane filter system, which is called ultra filtration, and IVT. That's it. Per liter, you can make 40,000 doses every 5 days. So compared to the regular vaccine facilities, which would need 100 or more acres, you can see that you only need a few square meters of space to create 50,000 doses. So I think for Samsung, creating mRNA, you don't need that much space. What you need is actually, I would say, vialing. So just filling whatever that's created into a vial. That's what had to be done, and that took up most amount of space. So I feel like this mRNA technology itself is going to totally change the vaccine industry and the game. What we have is different from Moderna. We are using liposome system, and we use a multi-amylase structure. So you can see that LMP patent issues were able to be avoided because of this technology. And for RNA, we don't have a particularly different RNA compared to Pfizer or Moderna, but CureVac's patents has already expired. that because it started in 2000s, and BioNTech's, when he was in UPenn, the patent that he registered back then, the study was published in 2005 and the patent was registered in 2007. So the original patents for mRNA is about to expire anyways. So if we have to compare Moderna's and our solutions, I would say the biggest characteristics of our solution is that polyethylene glycol is not used for our solution. So I think what I assume that is that Moderna, Pfizer, the system was not created targeting vaccine. It's more like gene therapy or other purposes that they were researching on this particular structure. So the application time was longer. They were focusing more on safety so that it could be delivered to all tissues of human bodies. Whereas if you only look at vaccine purpose or use, you don't need to specifically think of heart or liver or lungs. All you need to focus is make sure that it's reflected in the muscle tissue itself where you inject. That's safer and better and more efficient. So sometimes anaphylaxia shock could be induced by the use of PG, and we decided to not include this particular matter to our solution. And also, I would say the weakest point that Moderna has is preservation, because you have to freeze it, totally freeze it, and also have to deliver it in that specific status. But our solution solved the problem. So let's say Moderna has to be stored in a -20 to -70 degrees Celsius environment. For us, it could be stored in 2 to 8 degrees Celsius environment. And you can store it for 1 or 2 years. That's the shelf life. And we are keeping our solution at 4 degrees Celsius, but because it's powder type, I don't really think, even if it's in room temperature, that's going to cause that much difference when it comes to safety. And we are now carrying out many different tests using mRNA, but I would say the biggest data is still coming from COVID-related areas. You can see that significantly high number and amount of antibodies have been created over here. And for studies for mice, even if you put a significant dose where you could kill the mouse itself by injecting our dose, you can see that the morbidity and mortality rate have dropped significantly, and cross-reactivity is also being witnessed in our testing process as well. So as I shared earlier, even if you keep your solution at 4 degrees Celsius environment, the efficacy doesn't drop, and you can keep it for as up to 24 months. Moderna, Pfizer, you can only keep it for 6 months, so that's why you have to throw them away when it's not used. So I would say that this is a benefit or solution that we provided to the short shelf life of Moderna and Pfizer products. And of course, even though this is not favorable, let's say we would have to inject these vaccines every 2 times a year or 3 times a year. We have to think about side effects, what kind of side effects we're going to face. And let's say viral protein is going to impact your liver, lungs, or heart. Let's say you have remaining antibodies and viral protein is expressed in our organs, then we can't really say that that is not going to attack our organs at all. And if you repetitively use this dose, maybe you might not die, but there will be a significant pain that you have to go through every time injection occurs. So I believe that if you look at the very right end of the side over here on my slide, if you look at the back over here, you can see that this is being exposed in lungs. Whereas if you look at our injection, there's no expression other than the injection site itself. And if you look at major organs, it's not impacting other major organs. Vaccine proteins are not found on those other organs. So in terms of mechanisms, we're much safer. And for human bodies, we've only injected 50 doses so far. But even among humans, besides the injection spot itself, there's no systematic side effects or impacts that were reported. And even among animal testing, Moderna, Pfizer, liver, or other organ side effects were recorded. Of course, it wasn't so severe, but there were some reports that the vaccine is impacting some organs. So I think in the mid or long term perspective, we have an advantage of safety and also easier shelf life for sure. So, as I shared earlier, in Korea, there are ongoing clinical trials. And as you know, domestic clinical trials are very tricky because it's really hard to find someone who hasn't been exposed to inoculation yet. We have to find them who haven't got any injection and carry out clinical trials. And for South Africa or Australia, because we are doing boosting testing, it would be much easier and quicker for us to get some results. And we are going to also embark on testing for Omicron vaccination itself because that's the place where Delta became Omicron. And many vaccine researchers or scholars say that just walk to a certain line and then that's going to be your territory. That's what's happening in the vaccine world. So in 2017, 2018, all the patents were almost zero, whereas after 2019, after COVID-19 pandemic started, all these patents are now being applied and registered. There's high competition, fierce competition, and I think many other treatment mRNA systems are going to be adopted, not just in vaccine itself. So we are going to be joining the movement as well, and we have been securing some patents too. So let me give you an example. The most common area or field, I think what Moderna and BioNTech did was cancer treatment, and with the partnership with other enterprises, we are studying cancer treatments as well. We are trying to transition mRNA from the existing technology to mRNA to get additional patents. And in addition, what we are focusing on with vaccine is tuberculosis. In Korea, tuberculosis patients, the number is probably one of the highest among OECD countries, even though this is not something that's preferable. And in other countries, foreign countries, they tend to experience tuberculosis in a small group or minorities or the vulnerable. Whereas in Korea, if you look at the patients of tuberculosis, there are many female teenage students who get tuberculosis as well. And if that happens, you could actually see a whole family getting infected and die at the same time. So what's problematic is that you get BCG when you are young, and then once you become a teenager, you lose all the shield and the protection layer. So instead of using the conventional protein-based vaccination, we are now trying to transition to mRNA-based tuberculosis vaccine. And moving on to influenza, currently there's no influenza vaccine. So we have been just using whole viruses to give a vaccination shot. but we are getting some support and advice from professors so that we can create an influenza mRNA vaccination. And I see more, probably the most number of patents coming in when it comes to influenza vaccine using mRNA technology. So we definitely need to note what's happening. And for RSV vaccine as well, creating massive protein and giving T cell immunity, we were trying to use mRNA to solve this particular problem too. And aside from this, in our delivery system, I would say a limitation we have is that it stays in the injected spot. It doesn't affect whole body, the total system. So it could be interpreted as a weakness, but it could also be seen as a strength. Let's say you would like to impact a specific types of diseases, for example, for eyes or for ligands or joints, then it's better because it doesn't spread and it doesn't go to other systems. So orthopedics or osteoarthritis or all the other regenerative studies are going to be jointly carried out with our solution and their current research accumulation as well. And because we are specialized in ophthalmology, we're going to try many different research projects so that they can develop further. Of course, we're still at an earlier stage. We're still at an research stage. It's difficult to inject to the spine directly from mouse, but as you can see, mouse's spine and the tail are all connected. And you can see that if you put an injection to the tail, it just stays there. It doesn't go anywhere, even if you inject it on the tail. So we are going to experiment with many solutions so that we can directly target joints to cure osteoarthritis. So our company is not so big. We have about 100 employees in total, 60, 70 researchers. We do not believe that everything is going to be done on our own. We will work with other partners, not just on our mRNA and other adjuvant protein systems and carrier systems. We do have those, but we don't believe that we're going to do everything from A to Z. Any partners, any enterprises can knock the door, and we are open to all types of collaboration and partnerships. And as a result, you can see that we have multiple partners. If you have a great idea, if you're interested in our protein adjuvant system or mRNA system, please feel free to contact us and develop any project with us. Thank you very much.